All right, so we got persuasive legal defense strategies. Number four, consent of the patients. Argument would be every patient made an informed choice to take birth control or other medications. They were not forced, coerced, or deceived. If an individual consents to a medical treatment, the provider cannot be charged with a crime. The persuasive element would be if the prosecution claims that the prescribing doctor is responsible, then logically every patient who took the medication would also be guilty of a crime. All right, so the consent of the patient would be a persuasive legal defense strategy here that Dr. Dow could use. However, that will fail because so why does it fail? So consent from a third party, the mother, does not override the right to life of another person, which would be the unborn child, right? So a parent cannot consent to the killing of their child under any circumstance. The unborn child has no opportunity to consent to their own death. So that's very, very simple. Let's read this again because I do believe that should be self-evident, right? As the unborn child had no opportunity to consent to their own death. So the precedent, the precedent in other crimes. A human rights tribunal would not accept a parent's consent to child murder or abuse as a defense, right? So that's certainly not the parents consent is certainly not it does not override the inherent right to life, right? There's a right to life, and then and so the problem, of course, is that these birth control pills do not prevent the pregnancy. And the baby is conceived, right? The baby is conceived, and the death is the issue. That's all for today.